So before we get started, I would just want to do some brief introductions for our panelists so you know who you'll be hearing from. First, we'll be hearing from Florence Engsomwe, who is the Jarapa Municipal Health Director for Ghana Health Services. She's been a longtime partner of Literacy Bridge Ghana and Amplio and a longtime champion of Talking Books. And we'll be hearing from her about the health context currently in Northern Ghana and the government structures, the government stakeholders that we're working with. We'll then hear from Georgina Amadou. Madam Georgina is a communications for development expert with UNICEF. She's been a driving force for communications for development in Ghana for many, many years, almost 20 years. And she actually, we can say she's formerly with UNICEF because she recently retired. And so we want to congratulate her on reaching that milestone, and thank you very much, Madame Georgina, for joining us, taking the time with us today. After Georgina, we'll hear from Tia Guma, who is the Executive Director of Literacy Bridge Ghana. He's also got a long track record of effective program development and management in post-conflict and emergency and developing settings. So thanks so much for Guma to join us today. And then finally, we'll hear from Ryan Morris, who is the Senior Program Manager at Amplio. Ryan has over 10 years of experience in the field in Niger, Mozambique, and Ghana on projects related to media, communications for development, education, and civil society strengthening. So like I said, each panelist will have about 10 minutes to share what they can, and then we'll do our Q&A after that. So without any further ado, let's hear from Madame Florence.
This important meeting. Just to share with you how in the northern part of Ghana, where we have a lot of health challenges, a lot of infrastructure, medical supply, human resource challenges. However, we are forging ahead with the support of our stakeholders. Currently, the northern part of Ghana has just one teaching hospital in Tamale, where all those in Upper West, Upper East, and the other regions have to refer their cases to. When it comes to Upper West region, we have the regional hospital. We also have a recently regional hospital with a municipal hospital, then 6 hospitals. The 11 districts do not all have hospitals. So the few hospitals are the ones that are serving the other population as referral centers. Now, when it comes to Jarapa, we have a population of about 106,000 people with just one hospital, the St. Joseph Hospital. We have 47 CHVs zone. There's the community-based health planning and services that gives services to the rural folks. We have 1 polyclinic. It means all the health centers in Jarapa refer their cases to Jarapa Hospital, that's the communities. Therefore, there's really a big burden of disseminating our health information at the rural level. There's also a lot of health challenges. Now, looking at the health facilities available, and now we have COVID-19 with these challenges. We need to educate the community. We need to empower them. And without these health facilities, how do we go around giving health services, educating these rural folks? Because over 50% of them are illiterates. And the health personnel who are there are just few. So we need certain support to get information down to these people. And I must say, Amplio, we say bravo to you for coming with this device that is the talking book. The talking book is very good. It's a device that we have used key stakeholders in the community. We have the director, we have our priest, the imam. These are people that we listen to In fact, when it comes to the community-based health planning and services, it is owned by the community. And these stakeholders, the chiefs, the imam, the community leaders, the volunteers, they play a key role. So Amplio with Literacy Ghana is supporting these community structures with this device where the key information is keyed in and is given to volunteers in the community. Now with our CHOs, in my district, 26 of these CHOs have received the talking book with the key information. Initially, we had some in for maternal and child health. Now we are privileged to have 26 of them for COVID-19. And with the information given, the communities are given this device. The CHO, when she's on outreach, because we as health workers, even with COVID-19, still provide health services, taking into mind infection prevention precautions. And so when they are there and they are rendering services, this device is kept at a vantage point where the key messages are played, especially on the signs and symptoms. How do we get COVID-19? What are the signs and symptoms? How do we prevent it? So these nurses put this book in a vantage point that while she's rendering her services to the community people, they are also listening to the key messages. There are times these devices are given to families. They keep the device at home while the woman is cooking, is playing, and she's learning. She's getting the messages. Whilst they are moving to the farm, they have the book that gives them the message. So I would say that this device has come really to help our rural folks, help us, because health infrastructure is really a challenge in the northern part of Ghana. Now, with the book, the messages given are in a clear language, the local language in Dagari that the people understand. And so you don't have maybe a nurse who is in front of them at times struggling even to explain, because those who keyed in the messages really use the language and the terms that the community people understand. So now, if you go around, you see our women, there are times they sit and they are understanding the social distances. So it is put in the middle there. I went somewhere and it was put on a basin, and they all sat around and they were listening. They kept the social distance and they were listening. So afterwards, I heard them now trying to say, oh, then the next one is, I will send it to my house. And you know, it meant that they had seen the importance of the talking book. They had learned a lot from it, and they felt that they should share that book with others so that all other people in the community will benefit from the messages they were getting. When you come to our northern part, especially Upper West, to be honest, health is really a problem. Getting health services to the people. Like I said, we have just one referral hospital. And we have in our hospital, we have 2 doctors. If you take the doctor-patient ratio, that is so bad. A doctor should be 1 to about 600. But now we have 2 doctors to 106 population. That is so bad. The nurses, the CHOs are just maybe 1 or 2 in the CHIP zone. And in the CHIP zone, you have about 6,000. The recommended population is 5,000, 3,000 to 5,000. But even in some zones, you have about 7,000, 8,000. And there are just 2. And within the 2, amongst the 2, maybe one is a mother, one is on leave, and the other one has to go to the other communities. And believe you me, our terrain is so bad. We have a lot of hard to reach communities that the nurses have to go. And so this booklet, once we have had it, we'll always give it out to the volunteers to send it to some of the hard to reach communities where the nurses cannot go. And so everybody is empowered because we know what COVID-19 has come to do. If we are not empowering our people to get the messages clear, then we are saying that all our population will be down with it and its consequences. So this is the few I want to share with you on health in the northern sector. We are doing our best with the support of our stakeholders and with these innovations that our stakeholders are coming with to empower our community in the times of challenges like this with little resources available. Thank you for giving me this opportunity, and I hope we'll continue to work together to improve the health of the people in our rural setting. Thanks so much.
Thank you so much, Madam Florence. Thank you. Next, we'd like to hear from Madam Georgina. Are you with us?
Just taking it from where Madam Florence landed, and being a retiree, and I would say the oldest person to have had experience with the talking books in the northern part of Ghana while I was working with UNICEF. I would just run you through a few areas, and then we can, if there are questions, we can look at that. I think that I really came into contact with this talking book since 2007, but unfortunately, we were not able to pick it or work with it because of a lot of procedures that we needed to go through. But thankfully, somewhere around 2011, we had the opportunity, and then we moved on. I would like to say that as I was introduced as a retiree, I worked with UNICEF as the Communication for Development Officer for about 12 years plus, but in the development arena for over 20 years. And this wonderful book, I will call it, really did a lot of wonders. And I know that there were 3 models to this book, where we had the first one being the household model, rotation model, where the books were given to households like what Madam Teresa was talking about, Florence, or listening. We had existing groups that the books were introduced to, because we were looking for all the opportunities where people could get information. And then from there, we also realized that with the CHVs concept, as she explained, was said that once it involved the communities themselves, community people planning for their own health, then it was important to introduce the talking books to them, because the health information messaging, most of them were not from the local, the books were recorded in the local dialect. So it was an advantage, because this was a big challenge, because people who were posted, or people posted to these rural areas, cannot speak the local dialects. And so for that matter, give out health messages in the local dialect zone. Actually see that nurses, rather their clinical role, people go home without, because there's so much, the procedures involved in the clinical aspects took a lot of time, and parents will not want to wait. Okay, the introduction of these books in the CHVs zones and communities for that matter seek to bridge that gap. So with the CHVs program, increased attendance, be very excited, because when they get to their attention is drawn to this playing, telling them things that they just see that they themselves in, and so the attendance increase. What I was talking about is just looking at the challenges that we had for the health staff delivering messages in the CHVs communities or CHVs zones. The fact that most of them cannot speak the local dialects, and then also secondly, most of the mothers felt that the health nurses rather stuck to the clinical aspects, and actually to the detriment of the health messaging. That was the preventive. CHVs is about prevention, but there was not much done that way, because they were more interested in immunization and doing other things, because there was not much time. And for that matter, most of the caregivers who attended those sessions felt that they were always being kept for too long because they have to finish that before the health. It's a problem. So these were basically some of the issues. And then for the consistency, because there was the language barrier, and then the consistency in the message delivery in health was not also very accurate, because people would say this today here and go to another place, and maybe it's a different thing altogether. But then the coming or the introduction of the books made things very simple, because the nurses are able to run their clinical health education is also going on, and participants as to what they have heard, what can they do, and then the participants get the opportunity to ask them questions for clarity. And I think that has been a very good thing that the books have also brought. And like I said, there's that high participation during the session, because the people are able to, or the caregivers are able to interact, ask questions. Then the language barrier, a nurse who goes to work in a community where she cannot speak the language, she's not too worried because she can do the clinical, whilst we have other volunteers from the community who will support in the maybe the facilitation session. One other funny thing or very good thing I have encountered during my monitoring as a C4D officer on the chiefs talking books is that even when they have community meetings, at certain times the chiefs nurses, that is the community of nurses, are able to play the book at such meetings for the whole community to listen to, because they have enhanced gadgets that makes it very loud for them to hear, and they are able to discuss the issues among themselves. Besides that, even when the books are being played around the chief's compound, any passerby, anyone who passed by the compound just got attracted to go and sit and then listen, and the nurses accepted them. So I think it had been a way of even drawing in more people, and not just the women who go for child welfare services and antenatal services. There are other people, like the men, who are also able to bring their children, and those who don't even have anybody to bring to the clinic, but just get curious to come and listen to what is being said by the talking books. So I think the talking books actually have raised a lot of awareness among the communities, and the communities are very excited, and most of them have even started practicing a lot of the issues, the good practices that are being turned out by the talking book. For instance, attendance to the child welfare clinic, attendance to antenatal clinic. Before then, as Madam Florence was talking, most people were not doing it because these people are really at the very rural areas. And sometimes they don't see why they have to walk all the way to the only health facility. But now the books are with them, and they now understand why they have to do it. So these are some of the advantages that the books have actually brought to the CHVs communities of the northern regions, in fact, 3 northern regions, districts, that I can say. I think I will pause here, and I'm sure my time would be up because of this breaking. If there is anything, then I can answer specifically later.
Wonderful. Thank you so much, Madam Georgina. Yes, I'm so sorry about those connection issues.
Okay.
Thank you, thank you. So now we'll hear from Mr. Guma, Tia Guma.
Okay, thank you very much. And please permit me to join the earlier panelists to express my sincere appreciation to be here to share with our audience how Literacy Bridge Ghana is collaborating with Ghana Service, UNICEF, and Amplio to increase the capacity of vulnerable people in northern Ghana to be able to protect themselves from the spread of COVID-19. Let me also mention that Literacy Bridge Ghana, since the inception of the Amplio talking book, has been using this technology to deliver awareness interventions across several sectors, including health, wash, agriculture, protection, and education. As such, I can say on authority that we are perhaps the most specialized organization in the application of this technology. Let me briefly add to the health context analysis that the first panelist talked about. The case load, as far as COVID-19 is concerned, as of yesterday stands at 1,154 confirmed cases in Ghana with about 120 recoveries. In the region where our COVID-19 response is taking place, basically we have about 8 confirmed cases so far. Recently, the government's advice on health stated that an estimated 3 million people are likely to be infected, and also with about 15,000 deaths. With majority of the people in Ghana living in rural areas and resource poor settings, this cause to worry. Let me also say that the need for information, especially in this time of COVID-19, cannot be overemphasized. For example, information on COVID-19 is what most vulnerable people in resource poor settings need in order to be able to take life-saving decisions on how to protect themselves and that of their families from the spread of COVID-19. For our project, basically for this COVID-19 project that we are collaborating with Ghana Service and UNICEF and Amplio to be able to bring life-saving information on COVID to the people, basically seeks to achieve one main objective, which is basically to reduce the exposure of these vulnerable populations to the rest of COVID-19. We have about 3 specific objectives that will contribute to the achievement of this overall objective. One is basically we are going to increase awareness on COVID-19. And 2, we are also going to increase the capacity of Ghana self-service structures, the district health management teams, and the community-based health planning and services compounds or CHIP zones, you call it, and community health volunteers to be able to effectively deliver this awareness campaign on COVID-19. And last but not the least is basically also strengthening our own capacity in LBG to be able to effectively coordinate and collaborate with other actors engaged in COVID-19 response. Our strategy is basically leveraging Ghana service structures. We are using the CHVs facilities, or in another word, you could call health centers, to be able to effectively, as conduits through which we can use our technology, the Amplio book technology, to effectively disseminate information to the people. We are also using Ghana Service community-based health volunteers who have been tasked to undertake house-to-house sensitization on COVID-19 using the Amplio book technology. Our response basically it will last for 6 months, and currently we are in 8 selected vulnerable districts of the Upper West region. We have plans to extend this campaign to the remaining districts in the Upper West, the remaining 3 districts in the Upper West region, and also 3 selected vulnerable districts in northern region of Ghana. So our estimation is that at the end of our response, we should be able to reach about 605,000 people with life-saving messages on COVID-19 across 14 districts in northern Ghana. Let me also use this opportunity to share with you, since we launched this campaign at the beginning of April, some of the successes that we have chopped. The Amplio token book is already making a difference in COVID-19 awareness campaign. For example, if not for the Amplio token book technology, it would have been difficult, if not impossible, for some chiefs, nurses, or staff to educate people in their catchment areas because of the language barrier. I'm sure the previous panelists have articulated this very well, but I just want to reiterate this to the audience. Secondly, the chief nurses have reported to us that this technology that we are using to deliver this awareness campaign is helping them to be able to conduct very organized and productive awareness sessions on COVID-19. I wouldn't say our COVID-19 response so far is without challenges. I will just mention one or two of the challenges that we currently have in our response. However, we are able to navigate around these challenges and still able to effectively deliver this awareness campaign to our operational target areas. One, hikes of prices of essential supplies. Basically, with this response, we need certain supplies to be able to keep our staff and volunteers safe as they go about responding to this COVID-19. And some vendors are using this opportunity to profiteer from the situation. However, we have taken a decision to consolidate all supplies for COVID-19 and purchase it at once, so that we don't keep having this challenge. We've also received reports from our community health volunteers on the ground who are at the front line of delivering COVID-19 awareness campaign at community level, that there are some attempts by political leaders at the local level to block this exercise. The reason is that in the past, in some of these areas where we are delivering this COVID-19 response, we used to run a household model where basically the households had the opportunity to receive the token book, get to listen to the token book messages for a particular period of time, then it rotates among all the households in the community. But this time around, with the risks, with the risks in terms of passing a device around households, we thought that we should have the community health volunteer basically going to these households and operating the device so that we don't have so many people who are touching this device. It could be a potential source of COVID-19 spread. So we've equipped these volunteers with personal protective equipment such as hand sanitizers, rubber alcohol, soap, to be able to maintain a personal hygiene, as well as also ensure that they are practicing social distancing when they are holding household level awareness sessions. Last but not least, given that this operation is basically targeting how to reach communities, how to reach areas, the terrain is quite challenging as well. Basically because we are delivering this awareness campaign across 8 districts in 207 health facilities. So that's quite a lot. Going around these areas, most of these facilities are located in hard to reach areas. So this is one of the challenges we are having. However, we are able to still effectively deliver this intervention. So I will pause here a bit and allow for any questions regarding what we are doing in our way to be able to support the government of Ghana's efforts in responding to COVID-19. Let me also say that the situation in Ghana, for example, it appears that efforts are concentrated in the urban settings where there is already some capacity. In the areas where we are basically responding, that is where the challenge is. And should there be any massive outbreak, the impact will be devastating, where you basically do not have a capacity. So the focus of this intervention is reaching out to the very vulnerable people who do not have access to effective means of receiving life-saving information on COVID-19. Basically, what we are doing is empowering them to be able to know the signs, the basic signs and symptoms of COVID-19, as well as what measures can they take to be able to keep themselves safe from contracting COVID-19. Thank you very much, and thank you to your audience.
Thank you so much, Guma. Thanks for that. That was really, really informative. The last person we're going to hear from is Ryan Morris of Amplio. I want to just give a quick reminder to everybody that we'll do our question and answer right after Ryan is done with his presentation. And please submit your questions via the chat function to Amplio Network, to the host Amplio Network, which is me. I'm gathering all the questions. And so I see a few questions come through already, and we're looking forward to hearing some more from you all. So Ryan, please take it away.
Great. Thank you very much to the panelists and to all of our attendees for this first webinar. I'm so delighted to hear about these great lessons learned and really exciting activities that are going on the ground right now with Amplio's Talking Book technology. And so as you heard from our panelists, we at Amplio, we really understand and are committed to reaching the world's most vulnerable, really focusing on those off-grid media dark communities. And you heard about a lot of those different challenges from our panelists today. And so I just want to come back to that again. And so as you're thinking about how do we reach these vulnerable communities in a way that's meaningful, especially in this new context of COVID-19, right? And so, why talking books? As you heard from our panelists, this is an equitable and dedicated device. It's something that is used for learning. It's been engineered with vulnerable communities. And so as you can see, for people that have low literacy or low numeracy skills, it's still very easy for them to use this device. We also heard from Madam Florence and Madam Georgina talking about the challenges of posting health workers or other agents across the country, and those agents not really being proficient in the local language that's being spoken in those areas. And so when that happens, how are you able to really guarantee consistent delivery of this vital communication? And so, as you saw, with this device, with this technology, we've been able to do this. Our partners have been able to do this to really get out messaging, and of course, with this focus on local language. One thing that I think was really key, especially if we're looking back on the successes that we've seen in Ghana, is the sort of data analytics capabilities that exist within the Talking Book device. And so when we're talking about off-grid communities, people that have difficulty with literacy, numeracy, they may or may not have access to information, to radio, or to cell networks. It's difficult sometimes to really understand what are the challenges or the successes or the obstacles that those individuals are facing in adopting a behavior or accessing an essential service, whether that barrier, whether it's financial or material or sociocultural. And so being able to see how your users are engaging with your messaging, being able to look at that data and to share that data with your stakeholders and to understand, if we put these messages out about nutrition or about COVID-19, are people listening? What are we actually saying? And then of course, one thing that is also very amazing about this technology is the fact that our users are able to record their voices, they're able to record their questions, they're able to give their comments. And so this is an excellent way to be able to elevate citizen voice, people whose voices are often not heard because of those barriers to access or communicating with them. And so even in the case of Ghana, we've been able to see, really amazing, feedback from people in which they've, articulated their needs, they've voiced their rights, they've voiced and articulated the challenges that they're facing in adopting behaviors or accessing services. And so, using this technology and being able to have documented the engagement with the messaging, to be able to have documented what are people actually saying, and to really share that information with stakeholders and have these really sustainable feedback loops between communities and duty bearers and other decision makers, so that way people can really understand what's going on. We know that when we're dealing with this type of programming, oftentimes, the challenges that people are facing with behavior change, it extends beyond the individual and extends beyond the community. And so being able to really understand, what those determining factors are and being able to share that information and coordinate effectively with your partners is definitely an advantage that you have using this technology. And then of course, this is a flexible platform. And so as you're out in the community, as you're looking at your data, correlating it with what you get from the talking book, trying to understand how to most effectively serve people, as you get that data in and you need to make changes to either refine your programming or refine your messaging, our platform is flexible enough to really help you do that. So those are just a couple of comments there about our technology. And so I want to talk to you just a little bit about some of the impact that we've seen. I know this is the burning question. And so very recently with UNICEF Ghana, we were able to conduct a randomized control trial. And what we saw for this programming was that users of the talking book for UNICEF Ghana's Communication for Development Talking Book program, those families were significantly more likely to sleep under bed nets and wash their hands with soap and water. And so we know that in vulnerable communities, this is especially important. And of course, in this new context of COVID-19, this is absolutely essential. And so another thing that we saw here was that 91% of the users of the talking books also reported that they had applied a new health or agriculture practice. So just another example here, talking books are also being used currently on USAID's Afya Timiza program in Kenya, which is a program that's very much focused on maternal and child health. And so very much like in the Ghanaian context, talking books were used to train and to equip community health volunteers in Samburu and Turkana counties. And so these are two counties that have extremely high health burdens, very low access to radio, lots of issues with literacy. And so, with the work that the teams out there were able to do with this messaging, what they saw on their intervention sites was a 110% increase in the number of pregnant women completing 4 ANC visits. And so this was really exciting and really significant. And I really think just, speaks to the power and the potential of this technology for, for underserved communities. So if you are thinking about talking book technology, and if you would like to know how you can incorporate talking book technology into your programming, please come and talk to us. Not only are we, providing this technology, but we also have a team of professionals here with significant experience working overseas, designing strategies, monitoring and evaluation strategies, program strategies, and sustainability strategies to integrate this type of technology into broader, programming activities. And so if you'd like to, start a talking book program, it's very, very simple. And so what you would do is you would sit down with us, you'd plan your program, we would help you prepare, set up your technology and configure your devices. Of course, you'll learn. We'll give you access to our training resources. We also provide remote training, and we're going to be launching next month a learning portal with e-trainings, which will also allow our partners around the world to come back to those resources and really scale their programs and involve more people. And then you get to the create phase. Create your content, test your content, you deploy it out into the communities. Once the content has been loaded on the talking books and deployed out to the communities, you allow your community to engage with the messaging. You go and collect that data that we talked about earlier, that engagement data, hear what people are saying, analyze that data, correlate it with other data that you're receiving from the field, from your community monitoring visits, and then you can improve your programming, improve your content, and start all over again. So please, contact us if you would like to have more information and set up a consultation. And I'm going to hand it back over to Lindsay. Thank you very much. And thank you again to our partners at the Volo Foundation for their generous support, and of course to our ongoing partnership with ARM Holdings, which has also been just really critical in us being able to do all of this work and really serve these communities in a meaningful way.
Thank you so much, Ryan. That was great. And thank you to everybody who's been submitting some really wonderful questions. I'll just say right now, we have many questions that have come in that I know we won't have time to get to all of them, and we will record all of your questions, save them, and when we send out the post-event email, we will answer some more questions in writing that we didn't get a chance to get to during the session. So the first question that I want to put to our panelists is about the process of updating the messages. We've gotten a couple questions about the logistics that you're dealing with in the field right now in this context about how often are messages being updated? How do we make sure that people are getting up to date and relevant and accurate information? And also just how are you managing getting new messages, new content uploaded to the talking books in the field? So Guma, maybe you want to take this one?
Yes, I will take this one. Thank you very much, Lindsay, and thank you for the question. I think for COVID, for the COVID response project that we're basically running, we have put on the talking books all relevant information about COVID that is available to people, especially in Ghana. The Ghana Service release is a protocol on how to go about educating people on COVID, what information to provide or to disseminate on COVID. We have used all that to create the content. However, given that COVID-19 appears to be quite fluid, it's a new term, novel, and as well as the fact that we're beginning to receive new information, should there be need to create additional content, we'll do that, because it's basically what we have provided is reflective of what is available in the country here, as well as what WHO is encouraging people to know about COVID and how to protect themselves. So for now, we have done a one-off update. However, depending on the need, we shall do another update or many more updates.
Thank you. That's great. Thank you. We have another couple questions related to feedback from users, from community members. This question is, did you get the opportunity through the talking book to have feedback from the community on the local provision of health services? And if yes, how is this feedback processed? So Guma, or maybe Georgina, you can talk about how user feedback is collected through the talking book.
If If Georgina isn't on, maybe I could take the question.
Sure.
Take this one too.
I'm on, but you can start and I can add on.
Okay, so basically for COVID, given that the token books have been distributed to community volunteers as well as chief nurses in the health in the health facilities, they've been tasked with the responsibility to be able to respond to questions that come up during the awareness sessions. For example, there is a mechanism in the device that allows someone to be able to basically record your feedback. It could be in relation to the content, or could be any issue around their general health situation or developmental situation in the community. So once that is recorded, what we do, the process is through where you basically have someone who is looking at the feedback that has come in, trying to decode it. Basically, the technical term we use is basically trying to see how we can convert the messages that are in the local dialect into English in a way that still maintains the same meaning. So we get an expert who helps us to be able to basically translate that message in the local dialect into English language. And based on that, we are able to either, if it's a question, or if it's a comment, or it's an endorsement, we are able to respond to that. But for COVID, the issue is that given the fact that it's important to receive immediate feedback, a response to feedback, we have been able to connect chief nurses with community volunteers. So should there be any question arising out of the awareness campaign, chief nurses during their home visits or arrest sessions, they are able to get in touch with community volunteers and provide responses to the questions that have come up. So that is how we handle feedback. But in our normal talking book programming, we go through another process, because basically all the feedback that are recorded through the device, we are able to receive it through a cloud system. We have a dashboard where everything filters through, and we are able to basically process it manually with the help of an expert into the English language, and we're able to then disengage stakeholders or provide direct responses to these people asking these questions.
Great, thank you.
Yeah, can I just say a word? Hello?
Yes, we're hearing you.
Hello?
Yes, we hear you.
I think what I wanted to talk about, Guma has already said that, but I just want to add that in terms of the feedback to the stakeholders in the past for the other programs, we succeeded in getting certain issues addressed by those stakeholders in the communities that raise such issues. So I believe that with the COVID-19 issues, maybe the health staff can also help to address some of those issues. So I think it's a very good device, since that feedback can always be played back. Thank you.
Yes, thank you. I want to do one more question, which means we'll probably go a few minutes over our time. I apologize that we're running long, but I think this is a great conversation, and I do want to get at least one more question to our panelists. So we had one really great question about integration with community radio and how talking books, messaging on talking books might complement or integrate with community radio or even other communications channels. Brian, maybe do you want to talk about that a little bit?
Sure, thank you. Fantastic question. And so, you know, the really wonderful thing about the talking book messages is that it's on demand. and users can listen to the messages whenever they want to. And we know that unfortunately with radio, that can be not always possible for people. And so being able to listen to local language messaging whenever you want is definitely something that people find very appealing. And so if you're working with community radio stations and you are putting content out on radio stations, you can have complementarity between the programming that you'd have on your talking book, and as well as your radio. And so if you're working with radio spots, if you're working with serial dramas, all of those things, can be put on both the radio. They can also be, put onto a talking book device, and they can really, support each other and support that messaging to get that sort of surround sound effect, around messaging that you would hear coming from all of those different angles. And then, thinking about, other different, other communications channels, even what we've seen in Ghana is, we've got different partners, and even right now the government, has a hotline, where people can call in and get information about COVID-19. And so, using, the messages that you're putting on the talking book to provide information, but also, giving, a pitch or, reminding your users about, other services or resources that might be available to them, at the local level. And so Literacy Bridge Ghana, for instance, was working with a partner, Savannah Signatures. And so they were running a hotline. They were using the talking book messages to disseminate information, to loop people to the hotline. And then the data that was collected via the hotline was then correlated with the data that was being tracked and collected by the talking book. And all of that was then used to make different decisions about how to improve programming, or what types or issue areas need to be addressed in training or other aspects of program. But thank you.
Thanks, Ryan. Great. Look out for our follow-up emails post session in your inbox. Thanks so much.